This conference will now be recorded.
Good morning. This is Cindy Klein from Health First. I'm here to share some information about reference-based pricing, or RBP, for not only our scheduling caregivers, but also our business office and billing office. I want to just go over a little bit about what RBP is, what you can expect to see, and, how we can deal with it in the market. So reference-based pricing, really, this is kind of a kitschy little intro. It'd be similar to you driving up to a gas station and filling up your car and saying, oh, here's $5. That's the usual and customary amount for this kind of gas, and that's what I'm going to pay you. We're good, right? That's a little bit how the attitude about reference-based pricing is seen from the payer side. What it really is, it's a system where some self-funded employers, they use this product for reducing what they have to pay for healthcare costs. But unfortunately, the patients are unknowingly responsible for the difference. Imagine what that could feel like if you think you have coverage, and then after your procedure or your hospital stay, when you think you only owe a certain amount out of pocket, you end up with this big bill at the end. So the patient really believes they have coverage. However, there's no real contractual network between that product, the RBP plan, and our hospital system or any of our providers. Those RBP plans just pay whatever they feel is usual and customary. So they can look and say, it doesn't matter what you bill, we feel you're only entitled to this amount of money. So it really shifts the financial responsibility to the patient because they will be balance billed for the remaining. That means, say they have a hospital stay and we bill $100. And then all of a sudden, the RBP plan decides to just pay 70 of it. The 30 extra dollars gets billed to the patient. That's unlike some of our big managed care contracts with insurance providers such as Aetna, Blue Cross, United Healthcare, Cigna. We have a contractual amount that we have agreed to pay them from the billed charges. And so we adhere to that, and that's why those patients don't get balance billed. I know here at Health First, we have our own rates, and the hospital has agreed to allow those rates. And so when our members go to one of our facilities and use their ID card, they can be confident that they'll pay their specified out-of-pocket, and that is all. So the RBP plans really don't align with our UT Health East Texas mission. When that patient gets balance billed and they don't understand their financial obligation, to them it appears that we're not fulfilling our mission to care for them as patients. It doesn't matter how seriously we take our service excellence vision. Ultimately, at the end of the day, those patients are going to feel like they got hoodwinked at some level because their employer has told them they're covered, and they come after their treatment and they have this huge bill that they didn't know that they were going to be responsible for. So it's really imperative that we educate our patients and guests about their options before they schedule elective services. Now, obviously, if something happens in the emergency room, we're going to see them and bill those plans, and we will receive some compensation back for that. But, it's not in the best interest of those patients to not understand the plans that they have through their employer and that they pay with. Here's a sample letter that was sent to the brokers of those insurance policies in the market. Again, these are for self-insured employers. And I'm not talking about the Blue Crosses or the Aetnas out there. This letter, we tried to be proactive and tell the brokers in the community and in the East Texas area what it means to their clients and the members of those plans. So really, this letter is just trying to say that in reality, the RBP plan shifts the burden to the employees enrolled in those plans, and that UT Health and its affiliated physicians position on the plans is they do not accept reference-based pricing medical plans, and we are not in communication or negotiations to accept them. We will not schedule elective services for patients enrolled in these plans, and in the event that services are provided to the patient enrolled, we will balance bill for the fees above the arbitrarily set reference-based price up to full charges. So it's really imperative that you consider and look out for these plans ahead of time so that member or guest is not put in this position. So let's try to get some information about what you might encounter. If someone may call in and look to schedule something and you realize from their ID card that they really don't have a negotiated network, I'll show you what that looks like in a minute. But they may get really frustrated and say, I've been using this plan for a really long time. And that's possibly true because prior to UT Health purchasing ETMC, there was no policy that we wouldn't take RBP plans. So we've been taking them for a long time. So please try to sympathize with those guests. They are going to be frustrated about not being able to use their plans now. We have to assure them that we do want to serve them, but our network of hospitals, clinics, and physicians are not part of their current employer plan. They can certainly let their employer know. One of the reasons that big employers are buying these plans is because they're being told by the makers of this product that UT Health accepts these plans and always has. But there are things that we can offer them. First, how can you tell from their? Let me make sure I've got this. How can you tell from their ID card that they have this kind of plan? Well, they're difficult to spot, quite honestly, and they're tricky. They use words that you see on normal insurance cards, like all providers accepted, Allied National, PHCS, PPO information, PPO network, Assured Benefits Administrators, which is one of the big groups that offer these RBP plans. So it's really important to review the card thoroughly because sometimes some will mention that there's no hospital benefits, no percentage of reimbursement, and other key things that you will see. I'll show you in a minute. And that will alert you that it's possibly an RBP plan. Remember, there's options, though, to share with the guest. We can offer them the cash pay price, and actually we hope that you quote that private pay pricing. That's one of the options. There is an MD Save option. I know you've all been trained on that. So you can if they're in face-to-face with you, you can hand them that MD Save card. That's an option for them. And if they're on the phone, you can still tell them about the MD Save card and offer to assist them in purchasing an eligible test for staff. That they have a phone contact. Scripting has been provided by Mindy for our representatives, and I think that scripting is going to all of our facilities. But you can give them options. But the first thing to do is to try to spot these plans. You'll see here that they are really tricky. The card at the top right here is a real plan. It's a PHCS plan. It's still administered by Assured Benefits, but you'll see that it's to locate a provider or hospital. That means it's got a provider and hospital in their plan, and that is truly a PPO network. So this is a real plan, right? But if you look down at this one, this is an RBP plan. It says, this plan does not utilize a PPO network for hospitals and are reimbursed by the plan in accordance with terms of the plan document, which allow current Medicare rates by the employer as a maximum allowable charge. So what they have here is still a PHCS logo, but that's just for providers and physicians, not hospitals. So the RBP plan is going to say, okay, for a hospital, I'm only going to pay you a certain percentage of what we deem is usual and customary. And this plan right here, we do not want to take. We will let them know that they do not have a negotiated network with our hospital or our facilities. Here's another look at what a plan like this could you'll see on it. This is another Assured Benefit Advisors, and right here it says preventive services only, no coverage outside of the network. Says right here no hospital benefits. So this is a very serious card right here. There's nothing here to indicate that they will be covered at either our providers or our hospitals. And here's yet another one for Assured Benefit Administrators. You probably know this group, Azalea Orthopedics. They just got on this plan. And it says here, the plan does not utilize a PPO network. All providers are reimbursed by the plan in accordance with terms of the document, which allows current Medicare rates by the employer as a maximal allowable charge. They don't have a network at all, and we really cannot schedule elective procedures here. Now, of course, if it's an emergency, we take all patients in an emergency. We'll build these plans, and that we will get reimbursed something, but we should not, and I implore you not to schedule one of these guests for an elective procedure because they will be balance billed. Okay, here's another one, and it says, it's pretty deceiving because it says all providers accepted. But here, they're dictating what the reimbursement rates are. Physician services are reimbursed up to 125% of Medicare, and medical facilities up to 150%. Up to. We have no idea. It's arbitrarily set with how they're going to reimburse us. So those really are, again, like throwing your $5 out there and saying, here's what I think is fair for your gas, and why we use that as a simple scenario to kind of level set what this means. Currently, we know some groups that are using these RBP plans, but it's ever changing. What we've seen is that these products are being pushed in our market more aggressively than they've ever been. Currently, so you can't just look at this group and say they're the only ones using it. You will see more and more smaller groups trying to save money, thinking that this is a good option for them. So as we've already been talking about, Azalea Orthopedics using an RBP plan, but the Catholic Diocese of Jackson, Delco Trailers, Evans Air Conditioning, Alvatech, Isaac Services, Leatherwood Manufacturing, Meals on Wheels, MJM International, Mount Airy Partners, SDS Petroleum, Southern Surgical Arts, and Times Square. Those are the ones we know right now that we've seen ID cards come through, but please don't let that be your only list. Look at those ID cards and, again, consider the words on them and look for that network. So for our billing and business office, the one thing that we want to really drive home as a point, we do not want to participate in the plan appeals process that we appeal their payment. Because if we do, it prohibits us from pursuing the patient for the balance. And quite frankly, we then have to go through an entire appeals process, which they're ultimately not going to pay us, and then we have no way to collect any of the other the remaining balance. I just wanted to share this with you through a webinar so you could see it and hear my voice. You will have scripts and other information that's given to you over time, but if you have any questions at all, you can certainly talk to your supervisor, or you certainly can call the Health First office. Again, my name is Cindy Klein, and you can reach me at 85795. Health First is part of the UT Health East Texas system, and we're here really to serve not only our patients and their families, but each other. And this is a great way to start. Thank you all for listening.